What are the clinical features? Mild to moderate bleeding happens after surgery or severe trauma. Some patients with severe deficiency may have minimal or no bleed. As I just said, the amount of factor deficiency does not correlate with the actual clinical bleeding. Surgical bleeding is more prominent in the oral cavity. This is one point which can be asked in exams. This is because the oral cavity is an area of high fibrinolysis. Usually mucosal surfaces like oral cavity, like nasal mucosa, like sometimes the vaginal area, uterovaginal area. These are the areas where fibrinolytic activity is high. And so conditions where this fibrinolysis activity is high, this fibrinolytic activity is more, you will find more bleeding happening in these individuals. So oral bleeds, oral cavity bleeds, epistaxis, sometimes menses related bleeds, they are more common in patients of factor 11 deficiency. Why it is so? Because factor 11 helps in the generation of thrombin activatable fibrinolysis inhibitor. So when there will be no factor 11, it will produce unchecked fibrinolysis in these areas, especially oral cavity, and so it will lead to increased bleeding in these individuals. So remember that in factor 11 deficiency, areas with high fibrinolytic activity like oral cavity, like nasal mucosa, like uterovaginal bleeds, uterovaginal area, bleeding from these sites is relatively